Right now, as you are watching this video, your ankles might be quietly filling with fluid. You might not even notice it happening. Maybe your shoes feel a little tighter by evening. Maybe the elastic of your socks leaves deeper marks than it used to. Maybe you have looked down at your feet after a long day and thought, that does not look quite right. And then you probably did what millions of people over 60 do every single day. You dismissed it. You told yourself it was just the heat, just a long day on your feet, just another normal part of getting older. But here is what I need you to understand, and I say this as someone who has spent decades treating patients with heart and kidney problems. Ankle swelling after 60 is not always just aging. In fact, it can be one of the earliest visible signs that your heart or kidneys are struggling, sometimes years before you experience any other obvious symptoms. I am not here to frighten you. That is not my purpose. But I am here to make sure you do not ignore something that your body might be trying desperately to tell you. Because when it comes to heart and kidney problems, the difference between catching something early and catching it late can be the difference between managing a condition comfortably and facing a medical crisis. So if you have noticed any changes in your ankles or lower legs, if your feet seem puffier than they used to be, if you have wondered whether this is something you should mention to your doctor, please stay with me for the next several minutes. What you learn here could genuinely change how you think about this common symptom. Let me start by explaining what ankle swelling actually is in simple terms. Doctors call it peripheral edema. Edema just means fluid accumulation in your tissues. Peripheral means it is happening in the outer parts of your body, typically the lower legs, ankles, and feet. Your body is constantly moving fluid around. Blood carries fluid out to your tissues, and then your veins and lymphatic system are supposed to bring it back toward your heart. When this system works properly, you do not notice anything. But when something disrupts the balance, fluid starts to pool where gravity pulls it, which for most of us means the ankles and feet. Now, here is why this matters so much after 60. Large cardiology registries and recent Kidney Society reports have consistently shown that peripheral edema is remarkably common in older adults. And more concerning, many analyses suggest that a significant portion of people with new or worsening ankle swelling have an underlying heart or kidney issue that has not yet been diagnosed. In other words, your ankles might be showing you a problem that does not show up anywhere else yet. They might be your early warning system. By the end of this video, you will understand when ankle swelling is likely to be completely benign and nothing to worry about. You will know when it is a genuine red flag that needs medical attention. You will learn the 5 key patterns that doctors look for when evaluating swelling. And you will have practical daily habits and questions you can bring to your own physician to help protect your heart and kidney function going forward. I am going to share 5 truths about ankle swelling after 60 that most people never hear. We are counting down from number 5 to number 1, and I want you to pay special attention to truth number 1 because it ties everything together and gives you a framework you can use every single day. Before we begin, I want to hear from you. In the comments below, please tell me your age and when you first noticed changes in your ankles. Is the swelling in one leg or both? How long has it been going on? I read these comments carefully, and they help me understand what matters most to viewers like you. Let us begin with truth number 5. Not all ankle swelling is the same, and the type of swelling you have tells a very different story. This is something many people do not realize. They see swelling and assume all swelling means the same thing. But when I examine a patient with ankle edema, one of the first things I assess is the pattern and characteristics of the swelling itself. First, I look at whether it affects one leg or both legs. One-sided swelling often points to a local problem, something happening specifically in that leg. It could be a vein issue, like chronic venous insufficiency, or even a blood clot. It could be lymphatic damage from an old injury or surgery. Both legs swelling equally is more suggestive of a systemic problem, meaning something affecting your whole body, like heart function, kidney function, or a medication effect. Second, I check whether the swelling is pitting or non-pitting. This is a simple test. If I press my finger into the swollen area for several seconds and then release, does it leave an indentation that slowly fills back in? That is pitting edema, and it usually indicates fluid accumulation from heart, kidney, or vein issues. Non-pitting edema, where the skin springs right back, can suggest lymphatic problems or other causes. Third, I ask about timing. Does the swelling appear only at the end of the day and resolve overnight? That pattern is more typical of vein-related or gravity-related swelling. But swelling that is present first thing in the morning, that never fully resolves, or that has been gradually worsening over weeks or months, is more concerning for heart or kidney involvement. Let me tell you about a patient I will call Robert. He is 71 years old and came to see me because his left ankle had been swollen for about 3 weeks. Just the left one. His right ankle looked completely normal. Robert assumed he had twisted it somehow and forgotten about it. But the pattern of one-sided swelling that was not improving made me concerned about a possible blood clot. We did an ultrasound of his leg veins, and sure enough, he had a deep vein thrombosis. If Robert had continued ignoring that swelling, he could have been at risk for that clot traveling to his lungs. The key point here is that the pattern matters enormously. One leg versus both legs, pitting versus non-pitting, intermittent versus constant. These details help your doctor figure out whether the problem is in your veins, your lymphatic system, your heart, your kidneys, or your medications. Your action step for this truth is to pay attention to the specifics of your swelling and be ready to describe them to your doctor. Notice whether it affects one leg or both. Press gently on the swollen area and see if it leaves an indentation. Track whether it is worse at certain times of day. Who should be extra cautious here? Anyone with a history of blood clots, anyone who has had surgery or injury to one leg, anyone with known vein problems, and anyone whose one-sided swelling came on suddenly or is accompanied by pain, redness, or warmth. Truth number 4. Your ankles are connected to your heart in ways most people never consider. This is the connection that concerns me most because it is so commonly missed in the early stages. When your heart is not pumping as efficiently as it should, fluid can start to back up in your system. And because of gravity, that backed up fluid tends to pool in the lowest parts of your body, your ankles, feet, and lower legs. Heart failure is a term that sounds terrifying. But heart failure does not mean your heart has stopped. It means your heart is not pumping as strongly or efficiently as your body needs. And crucially, it develops gradually over time, often with subtle warning signs that get dismissed as normal aging. Ankle swelling is one of those early warning signs, but here is what makes it tricky. In the early stages, the swelling might only appear after a long day and resolve overnight. It might be subtle enough that you only notice it because your shoes feel slightly tighter. You might attribute it to the weather, to salt intake, to standing too long. But there are other symptoms that often cluster with heart-related ankle swelling, shortness of breath, especially with activities that did not used to wind you, unusual fatigue, weight gain that seems to come out of nowhere, sometimes several pounds in just a few days. Waking up at night feeling short of breath or needing extra pillows to breathe comfortably. Cardiology guidelines emphasize that these symptoms together paint a picture. Any one of them alone might have an innocent explanation. But when ankle swelling appears alongside unexplained breathlessness, fatigue, or rapid weight gain, it needs to be evaluated promptly. I had a patient named Dorothy, 74 years old, who came in because her daughter had noticed her ankles looked swollen at a family gathering. Dorothy herself had noticed her shoes were tighter, but assumed it was because she had been on her feet cooking all day. When I asked more questions, Dorothy mentioned she had been feeling more tired than usual for the past month. She had also noticed she was getting winded walking up her driveway, which she used to do easily. She had gained about 6 pounds in 3 weeks without changing her eating habits. All of these pieces together concerned me. We did some testing, and Dorothy was in the early stages of heart failure. The good news is that we caught it early. With medication adjustments and lifestyle modifications, her symptoms improved significantly. But if she had continued dismissing the swelling as normal aging, her heart could have declined much further. Your action step is to pay attention to symptoms that cluster together. Ankle swelling alone might be nothing, but ankle swelling plus shortness of breath, unusual fatigue, rapid weight gain, or trouble breathing when lying flat warrants a call to your doctor. Who should be extra cautious? Anyone with a history of heart disease, high blood pressure, coronary artery disease, or previous heart attack. Anyone with diabetes. Anyone with a family history of heart problems. Truth number 3. Your kidneys and your ankles are also intimately connected. Most people know that the heart pumps blood. Fewer people understand what the kidneys do on a minute-by-minute basis. Your kidneys are sophisticated filters. They process about 50 gallons of blood every single day, removing waste products and carefully regulating how much fluid and sodium your body retains or eliminates. When your kidneys are not filtering as well as they should, several things happen that can lead to ankle swelling. First, your kidneys may not be able to eliminate sodium efficiently, and sodium holds on to water. More sodium retention means more fluid retention, which means more swelling. Second, damaged kidneys can leak protein into the urine. Protein in your blood normally helps hold fluid inside your blood vessels. When you are losing protein in your urine, fluid tends to leak out of your blood vessels and into your tissues, causing edema. Here is what frustrates me as a physician. Chronic kidney disease often has no symptoms until it is quite advanced. You can lose a substantial portion of your kidney function and feel completely fine. Your kidneys do not hurt. You might have no idea anything is wrong. But ankle swelling can be one of the earliest visible clues. When I see a patient with new ankle swelling, especially if it is accompanied by foamy or frothy urine, poorly controlled blood pressure, or puffiness around the eyes in the morning, I am thinking about their kidneys. Kidney Society guidelines and recent meta-analyses have highlighted that many older adults have undiagnosed kidney function decline. In some studies, a significant proportion of people over 60 have at least mildly reduced kidney function without knowing it. Let me tell you about a patient named Margaret. She is 69 years old and noticed her ankles swelling about 6 months before she came to see me. Her primary care doctor had checked her heart and said it looked fine. Margaret was relieved and figured the swelling was just a nuisance, but the swelling persisted. Margaret also mentioned that her urine seemed to foam more than it used to. When we checked her kidney function and urine, we found that her kidneys were filtering at a reduced rate and she was losing protein in her urine. Margaret had early kidney disease that no one had caught because she felt perfectly healthy otherwise. Her ankle swelling was the clue that led us to the diagnosis. Your action step is to know your kidney numbers. Ask your doctor about your creatinine level and your estimated GFR, which tells you how well your kidneys are filtering. If you have ankle swelling, ask whether your kidneys should be evaluated. Also notice whether your urine seems foamy. Who should be extra cautious? Anyone with diabetes, anyone with high blood pressure, anyone with a family history of kidney problems, anyone who takes multiple medications. Truth number 2. The medications and daily habits you think are harmless might be quietly adding fluid to your ankles. This truth surprises many of my patients. Many very common, very useful medications have fluid retention as a known side effect. Calcium channel blockers, which are widely prescribed for high blood pressure, are notorious for causing ankle swelling in some people. The swelling can be quite significant. Non-steroidal anti-inflammatory drugs, which many people take for arthritis or general aches and pains, can cause sodium and fluid retention. This is especially true with regular, ongoing use. Some diabetes medications can cause fluid retention as a side effect. Steroids, often prescribed for inflammatory conditions, can cause significant fluid retention with long-term use. Hormone therapies can contribute to swelling in some people. Beyond medications, certain habits and situations can add to ankle swelling. A high-sodium diet is one of the biggest contributors. Sodium causes your body to hold on to water, and modern processed foods contain far more sodium than most people realize. Prolonged sitting or standing keeps fluid pooling in your legs due to gravity. Long flights or car trips are common culprits for temporary swelling. Alcohol can contribute to fluid retention in some people. I want to be very clear about something. I am not telling you to stop any of your medications. That would be irresponsible and potentially dangerous. Some of these medications are protecting your heart, controlling your blood pressure, or addressing other important health issues. But you absolutely must tell your clinician about ankle swelling when it appears. Your doctor might not know you have developed this symptom unless you report it. Sometimes a medication can be switched to an alternative that works just as well but causes less fluid retention. Your action step is to make a list of every medication you take, including over-the-counter drugs and supplements. Bring this list to your doctor and ask whether any of them could be contributing to ankle swelling. Also, honestly, assess your sodium intake and how much time you spend sitting or standing without movement. Who should be extra cautious? Anyone taking blood pressure medications, anyone using pain relievers regularly, anyone on diabetes medications, steroids, or hormone therapies, anyone who has recently changed or added a medication. Now we arrive at truth number one, the key insight that ties everything else together. Truth number one. It is the pattern of your swelling over time that tells the real story. This is what I want you to understand most of all. A single episode of ankle swelling on a hot day after standing for hours might mean nothing, but the pattern over days, weeks, and months is what reveals whether something serious is developing. I teach my patients to become observers of their own bodies. Not anxious overanalyzers, but calm, consistent observers who notice changes and can describe them clearly to their healthcare providers. Here is what matters in the pattern. How much do you weigh first thing in the morning? Rapid weight gain, like 2 or 3 pounds in a single day or 5 pounds in a week, is a classic sign of fluid accumulation and should be reported to your doctor immediately. What do your ankles look like first thing in the morning versus at the end of the day? If morning swelling is resolving overnight, that is more reassuring than swelling that is present around the clock and gradually worsening. Is it one leg or both? One-sided swelling needs evaluation to rule out clots or local problems. Both legs swelling equally is more suggestive of heart, kidney, or medication effects. What other symptoms are present? Swelling that appears alongside new shortness of breath, chest discomfort, unusual fatigue, difficulty breathing when lying flat, or waking up at night gasping for air is an urgent warning that needs immediate medical attention. This is where heart, kidneys, veins, medications, and lifestyle all come together as one story. Your body is a connected system. When your heart weakens slightly, your kidneys may compensate by retaining sodium, which increases fluid, which shows up as ankle swelling and weight gain, which makes your heart work even harder. But catching the pattern early interrupts that cycle. It lets doctors act when they still have many treatment options. Let me give you a simple ankle and fluid checklist you can use at home. First, weigh yourself every morning at the same time, wearing the same thing on the same scale. Write it down. Report any gain of more than 2 pounds in one day or 5 pounds in 1 week to your doctor. Second, once a week, measure around your ankle with a soft measuring tape, or pay attention to how deep the marks from your socks are. Notice whether this is changing over weeks. Third, compare your 2 legs. Are they equally swollen or is one worse? Fourth, pay attention to any new symptoms that appear alongside swelling: shortness of breath, chest tightness, fatigue, waking at night, needing air, foamy urine. When should you call your doctor right away? Call immediately if you have sudden, severe swelling, especially in one leg, with pain or redness. Call if you develop chest pain or pressure. Call if you become suddenly short of breath. Call if you gain several pounds in just a day or two. Beyond monitoring, there are some safe strategies that can help with ankle swelling. Elevation genuinely helps. When you can, elevate your legs above the level of your heart for 15 to 30 minutes at a time. This helps fluid drain back toward your core. Movement matters. If you sit for long periods, get up and walk around briefly every hour or so. Even gentle foot and ankle circles while sitting can help keep fluid moving. Be mindful of sodium intake. Most people over 60 would benefit from reducing processed foods, restaurant meals, and added salt. Stay reasonably hydrated. Drinking adequate water helps your kidneys regulate fluid balance properly. I need to say something clearly here. This video is educational information, not personal medical advice. I do not know your medical history, your medications, or your specific situation. Please do not start or stop any prescription medication based on a YouTube video. If you are concerned about a medication's side effects, talk to the doctor who prescribed it. If you experience any red flag symptoms, chest pain, sudden severe shortness of breath, sudden massive swelling, especially in one leg, seek urgent medical care. Do not wait. Now, let me leave you with something hopeful. Noticing ankle swelling early is an opportunity. It is your body whispering before it has to shout. Many of my patients who caught heart or kidney issues early are doing remarkably well years later because we intervened when we still had options. I think of a patient named William, 73 years old, who came to me because he had been tracking his morning weight and noticed he had gained 4 pounds in less than a week. His ankles looked slightly puffy, but nothing dramatic. William took the pattern seriously. We found early heart failure and made medication adjustments right away. That was 3 years ago. Today, William exercises regularly, travels with his wife, plays with his grandchildren, and his heart function has actually improved. William did not end up in a hospital crisis because he caught the whisper. He paid attention to a pattern that most people would have ignored. That is what I want for you too. I want you to have the information to recognize meaningful patterns, the confidence to report them to your doctor, and the knowledge to know when something is urgent. Your ankles are trying to tell you something. Are you listening? I want to hear from you in the comments. How long have you had ankle swelling? Is it one leg or both legs? What has your doctor told you so far? Also, tell me what health topics you want me to cover next. Are you curious about shortness of breath and what it really means after 60? What about fatigue that does not seem to improve? Let me know in the comments. If this information was valuable to you, please subscribe to the channel. I create these videos to explain the hidden side of common symptoms. Share this video with a friend or family member who has noticed ankle swelling. They might not realize what questions to ask or what patterns to watch for. Your body is constantly communicating with you. Sometimes the messages are subtle. Sometimes they show up as slightly tighter shoes, deeper sock marks, or a few extra pounds on the scale. Those subtle messages deserve your attention. Not panic, not anxiety, but calm, consistent attention and the willingness to ask your doctor what they might mean. Thank you for watching. Take care of yourself, pay attention to what your body is telling you, and I will see you in the next video.